Over the years, Nigeria has made some appreciable progress in health, education, technology, and the economy through various strategic investments. However, these gains have not significantly translated into improvement in the quality of life, as more people live in poverty with restricted access to good food, safe housing, quality education, and basic healthcare than they were 20 years ago. According to National Population Commission in 2017, there are over 180 million Nigerians, out of which about 40 million are women of reproductive age, representing approximately 1 in every 5 Nigerians. The United Nations projects that going by the current demographic trend, Nigeria's population will double to over 400 million Nigerians by the year 2050 unless something deliberate is done. In spite of past and current commitments to global goals of ending poverty, ensuring healthy lives, promoting well-being, and providing full and productive employment for its citizens, Nigeria still has one of the highest rates of preventable maternal deaths in the world, contributing to over 10% of the global burden. 5 women die every hour of pregnancy and childbirth-related causes in Nigeria. This is equivalent to 110 women dying every day and 40,150 women dying every year. These preventable deaths of our sisters, mothers, wives, daughters, and friends who are also Nigerian citizens negatively directly impact our families, communities, and our economy. Thankfully, there is a way to substantially improve this situation. This is where family planning or childbirth spacing comes in. Empowering families to have children they can adequately cater for will help in reducing economic burden and lift families out of poverty. When children are planned for and spaced adequately, it saves the lives of the mother and child by preventing high-risk pregnancies and increasing the chances of survival and future prosperity. According to the 2013 National Demographic Health Survey, 7.3 million women have an unmet need in family planning, meaning that they want to avoid pregnancy but they are not currently using any family planning method. This represents about 16% of married women in Nigeria. Meeting women's needs for modern contraceptives prevents about 1/3 of all maternal deaths globally. Nigerian leaders need to address this by making family planning services accessible to every woman, married or unmarried.
Currently, we have, for example, infant mortality rate of about 122 per thousand. If you're able to space 2 to 3 years, you're going to be reducing the infant mortality to about 67 per thousand. By the time you space the children to about 3 to 4 years, in fact, your infant mortality rate is going to be as low as 47 per thousand.
Family planning use in Nigeria increased only marginally from 8% to 16% in 2003 and 2013. According to a 2013 estimate, the total fertility rate, TFR, which is the average number of live births a woman in Nigeria has throughout her life, stands at about 5.5 children per woman, one of the highest in the world. This has declined only marginally since independence over 50 years ago, when it stood at 6.6. If we can get contraceptive to all these women who need them, we would prevent an estimated 1.5 million child deaths and stop about 13,000 women from dying over the next 10 years.
Making contraceptive information and services available to everyone who needs it. It's a moral obligation. It is a cost-effective way of reducing infant and maternal morbidity and mortality. It improves health and quality of life. It empowers families and communities on a pathway to poverty reduction. No woman deserves to suffer or die bringing forth another life. Every child deserves to live, thrive, and prosper.
A recent IMF report in 2018 shows that economic growth and recovery, although progressive, remains slow, barely keeping pace with our rapidly growing population, a pace that hampers efforts to boost employment and reduce poverty. Though there are other factors that contribute to the GDP, there is substantial evidence that countries that have reduced total fertility rate have significantly improved their GDP. Reduction in the total fertility rate is correlated with increased productivity, which enhances gross domestic product, GDP.
Naturally, we all know that the more people you have in a family, the more it will take to keep that family going in every dimension. Feeding them, clothing them, sending children to school. So the more you have in the family, the more children, the more you have to spend. And the less you have to invest, because investment often results from the leftover, haven't done the basics. So naturally, if you have large number of children, there's less saving, there's less investment. There is a direct correlation between lowered fertility rates and increasing family buying power.
Evidence suggests that in countries where families have the number of children they can cater for, there will be reduced economic burden on the household. If families enjoy this benefit of improved economic well-being, then you can imagine how this translates to boosting the economy of a nation like Nigeria. With reduced burden on the household resulting from childbirth spacing, families are better able to afford good food, attain higher education levels, and have better health care. Over time, healthier, productive, educated families are better able to contribute to national development due to a more productive workforce, translating to higher overall economic growth for states and our country as a whole. More healthy, productive, educated families lead to a better society and more productive country. With more controlled population growth, the government is better able to provide quality healthcare services, education, social infrastructure, and jobs for its citizenry.
Economic growth can be accelerated by prioritizing investments in family planning, in our socio-economic growth, and our recovery intervention. Government need to take the lead in ensuring that every man and woman in our urban and rural areas have access to effective family planning as part of their focus on maternal and child death improvement. It is not enough to provide family planning services. Government should also encourage people to take up family planning as part of the effort to improve our socio-economic growth.
The solution is in your hands. All you need is act now. Evidence shows that Nigeria can transit from a lower to a higher middle-income country in 40 years if she invests in more ambitious family planning programs. Family planning or childbirth spacing can help families to have smaller families, leading to massive economic gains that can potentially lift 53 million people out of poverty by the year 2020. Policy and decision makers at all levels must ensure adequate funding for childbirth spacing and family planning programming so that this important service is available at all primary healthcare facilities. Religious and traditional leaders speak up about the benefits of childbirth spacing. Health experts, managers, implementers, and service providers should provide family planning service to everyone who needs it without bias and speak up about the safety and effectiveness of modern family planning methods. Business leaders invest in family planning programming to support the efforts of the Nigerian government. Nigeria has the capacity and responsibility to do this. With the appropriate amount of funds and right policies in place, we all have the moral obligation to ensure that every woman can access family planning information and services. Remember that investing in family planning is investing for a lifetime of returns. We must get it together for a brighter future.